Substance misuse. I completely forgot to even include that because I know you've got the discipline there too. Can you give us one quick thing? Here's a scenario. Maybe you could just I'll give you a scenario base. I usually have some students that they are working in one of those states that they either recently legalized marijuana or legalized other drugs because there's other ones
Mhm.
legalized, and they always ask me, "Well, what do we do now with our policy?" And I said, "What's your current policy with any kind of use and misuse?" I said, "It's not going to change if it's legal or not. It's going to be pretty much what your company's policy. And yes, testing may end up having to evolve from what we're currently seeing, but
Mhm.
besides just the testing, is this person currently impaired, is what I mean by testing, then your policy should still be your policy. If you have a zero tolerance, it's your policy, no matter if it's legal or not. So am I steering people in the wrong way, or is that honestly what you tell them?
No, that's the approach I take as well. Is you that is why we have policies, right? That's why we have requirements. That's why we have laws. That's why we have regulations. One of the things that I ran into a lot of times is your HR professionals are going to look to your safety people, your safety consultants, or your safety, individuals to help, because if they keep in HR, their hands are kind of tied. So they can't really test a lot of times. But if it's a safety issue and you can say, hey, I'm testing either everyone, or I really do feel like this person is impaired, or, what have you, if it truly is a safety issue, make sure it's written in your policy that you have the ability to test, and that you are very upfront and honest with your workers on, their first day that you hire them, that this is our policy. This is, if we're zero tolerance, we are a zero tolerance. If you have any of these kind of, signs or symptoms, we will test you. Just make sure that you spell it out. I agree 100%. If it is your policy, it's your policy. There's no need to change it, because just because the state law changed in that state, you're still putting people at risk. If you are inebriated or intoxicated or high, and you're coming to work under the influence, you are putting yourself and everybody that you work with at risk as well, no matter what substance you're under, because you're not in that correct state of mind.